Simsim.
And we're live. All right, ladies and gentlemen, we got DPT, Kero Abdelmessih, Keraloos Abdelmessih. I don't know what do you want me to call you, Keraloos, Kero.
So my parents
K.
are phonetically challenged, and the way they spelt my name was Keraloos instead of Keraloos. So I just go by Kero. I rebranded myself on Kero.
Okay.
Kero the hero.
Kero the hero.
That's what it
All
is.
right. Good to have you here, buddy.
Thanks for having
I
me.
haven't seen you in a long time.
Yeah.
You were in my Sunday school class. I was your server. Don't tell me you don't remember that.
Dude,
Did you just realize that?
you're bringing back memories.
Okay, good thing you remember. Actually, I was kind of scared for a second.
Oh my God.
Yeah.
Wow. That was a long time ago.
Yeah.
I'm getting old, not you. It's you,
Ah,
not
I'm
me.
soon. I see everybody from my Sunday school classes getting married, and I'm like,
Yeah. Well,
I
you
should
don't have
start
many
moving to
gray
Florida.
hairs, so that's good.
well, I mean, I get a haircut every 4 weeks,
Yeah.
so it's.
Don't say that on air, man. Just say,
I
yeah, I
just-
don't have gray hairs.
I don't have gray hairs.
Isn't that great? That's it, yeah.
That's just the way it goes.
Yep.
Good to have you, buddy.
Thanks for having me.
Doctor of Physical Therapy, specializes in knees.
Correct.
Right? Is that? Did I get that right?
Yeah.
And I was just telling you before we started shooting that every time I see your videos, my knees hurt because your knees are, these are very intense movements that you're doing.
Yeah. Yeah. I mean, for me, the quads are king. So,
Hey, but yeah, I was going to say something else, but yes, absolutely.
yeah.
So, Dr. Physical Therapy, you went to Minnesota.
Minnesota.
See,
You
I
almost
said
said Montana. Almost said it. But yes, Minnesota for grad school.
Walk me through your journey. Like, why did you go to Minnesota? Why physical therapy? What are you working on now? Your clinic, office business, your videos. Like, just let us catch up with that.
Yeah, dude, for sure. So I can take you years back in high school when I really decided that I loved anatomy. So I took anatomy class my senior year of high school, and it was the best class. I was like, this is it. I love bones, tendons, ligaments, joints. I love that stuff. So I was like, this is what I want to go into. And of course, as Egyptians, we're like, the epitome of all professions is to become a physician.
Yep.
So then I went into college thinking I'm going to become a physician, but I want to do something with sports because, sports, right? Whatever. So then I was thinking, okay, what do I do actually with this? Do I become an orthopedic surgeon? Do I become a non-operative sports medicine doctor? Are there other options out there? So then I went through the first 2 years of school, and I haven't even declared my major at all.
Mm-hmm.
And I'm thinking, I don't really know what to do, but I'm taking all the pre-med classes. And then my sophomore year, I took the dreaded class at Rutgers University, organic chemistry.
Yeah.
You were about to say it.
Yep.
Took that class. I got a D in organic chemistry 1. And I
Uh-huh.
was like, nope, not doing this. This is not something that I want to do. I love things from a macro level, and I don't like the cell stuff. I like the muscles, the tendons, again, just general anatomy.
The anatomy part, not the physiology part.
Exactly. I do like a little bit of physiology.
Okay.
But just not the specifics of
How
biochemistry.
everything
and-
works.
Yeah, that's not for me. It's just
Yeah,
too minutia for me. So then I decided.
Minutia. Sorry, continue. I haven't heard that word in a long time.
Maybe I'll bring up some words here and there that you haven't heard. But yeah, so I went exploring and did some shadowing and talked to some people and was like, okay, I really like the realm of physical therapy, so let me go into it. I finally declared my major, which was exercise science, and that was my junior year, which is pretty late for people to declare their major then. Finished everything, minored in psychology, and then I was like, okay, I'm going to physical therapy school. I applied to, I want to say 13, 14 programs, and probably got 10 rejections before I even got one interview. And I was like, oh, God. But I ended up getting, I think, one interview somewhere in New York, then somewhere in Florida, and then I was on the wait list for the University of Minnesota. I was like, let me just do it. Let me just apply to any program out there that'll take me. My grades honestly weren't that great, and extracurriculars were like, I'm a hymns teacher at church.
Yeah,
It's nothing like, not really much that's going on there. So I was like, I just got to apply anywhere to get into PT school. So then I applied to the University of Minnesota and put me on the wait list at first. And then I think it was about a month later, they called me. I literally remember the exact call and what happened. I was upstairs in the Douglas Campus Center. I was working. I was doing IT at the time. And I got the call saying that you got off the wait list and in Minnesota. And I was like, wait, what? And it was a great experience. And then, yeah, I basically told myself this is what I want to do. But it was hard for me at first because it didn't really hit me right then and there that I was going to travel across country. Because, you know, I was surrounded by my parents and my community, my friends, my church, and everything here.
Right.
So then for me to go across country to a rigorous graduate program completely alone, not really knowing many people from over there, I was like, this is
in a different time zone.
Yeah. So that was rough for me. And I don't think that hit me until I actually moved over there. And that hit some points.
Yeah.
But
yeah. Especially that we don't move on until we get married.
Yeah.
Like you're in your parents' house until you get married. There's no living on your own.
Right.
At least in our community. So that must have been difficult.
Yeah. People just expect you to be able to become an adult. But when your parents are doing most of the stuff for you, right? They're cooking your meals. They're doing everything. You're commuting from home.
We have it really good.
Yeah, I know.
We have it really
super sheltered. So when I go over there, I'm like, okay, I can make a mean bowl of cereal, but that's it.
Bed the bastarm every day.
Every day.
Well, except you're at CL, but yeah.
That's basically what it is.
Yeah.
So went to University of Minnesota. I graduated over there. And there's actually a pretty significant story that comes along with that. So how it works at Minnesota, every PT program is completely different. But the first 6 weeks at Minnesota were just a crash course in anatomy. And the way that the upperclassmen described it to us coming in, they basically said that this is a course where you're in a car without a steering wheel and there's no brakes and you're just going downhill. That's basically how they described it to us. You just got to survive. Just survive.
Yeah.
And I was like, okay. And there's hundreds of muscles. And this is all about origins, insertions, where things are in the body, what nerve innervates them, what this and that. And it was in 6 weeks. And how the grad program works is basically if you get anything less than a B in the class, you are automatically put on academic probation. So if you get a B minus, which is not bad at all, like a B minus is a B minus, you know?
80, 81.
Yeah, around that range. Yeah.
Right.
If you get that, you're on academic probation, which means that if you stay there for the upcoming semesters, and it was trimesters every year, it's a 3-year program, then you're kicked out of the program. So from semester 1, not even semester 1, it's the first 6 weeks of the schooling, I got a B minus in anatomy. So then I was put on academic probation.
Well, so I was in an X-ray program before I did my undergrad.
Yeah.
And the program itself, you have to get a 76 or higher in every single course in order to graduate. If you take a quiz or a test and you get less than a 76, then you have to retake another version of that quiz or test. Like if you take it on a Monday, you got to take it on Friday or Thursday.
Yeah.
If you fail it again, because 76 or lower is failing. If you fail it again, then you're out of the program. So the first semester we were learning about it's called procedures, right? So it's like, you know, you're going for a chest X-ray, like what are the procedures?
Right.
You know, you got your PA and lateral, you got the decubes. So when you lay on your back, you're looking for water in the lungs and all that. So there's a lot of things that go along with it. So you learn it on Monday, and then you take a test on Tuesday, and then if you fail, you get to retake it on Friday. A classmate of mine failed on Monday, took it again on Friday and failed it. So he was out of that class, and he graduated a year after us because he had to reapply. So I know exactly what you're talking about.
Yeah.
But at the same time, I would want you to know what you're talking about, because I don't want you to be a PT and not knowing what you're talking about.
Absolutely.
So,
and
good for you.
It's funny that you say that, because I basically almost was in the same predicament. So I was on academic probation, and the next semester was like fine. I brought it back up, and everything was okay. The next year, I believe it was, or maybe it was in the spring of my first year, we ended up taking neuroscience or neuroanatomy with the medical students. So the PT students take like neuroscience with the medical students.
Okay.
We took it, and it was like one of the hardest classes I've ever taken in my life, because everything is just so complex with the brain. It's like, my God, did you have to do that for the sake of my studies?
Yeah.
But it was very complex, and I was questions away from failing that class, because it was pass-fail. It wasn't, you didn't get a grade with it unless you wanted to go with PhD track or whatever it was. But I just wanted to go pass-fail. But I was questions away, literally 2-3 questions from not passing that class. If I did not pass that class, I would have been kicked out of the program that first year. So it was just, you can imagine how the first year for me was just a whirlwind.
Intense.
Yeah, graduate school.
And you're by yourself.
completely by myself. Like I know some people because I had gone on a medical mission trip to Bolivia a couple years back. So I knew some people from Minnesota. And they fostered me and they did well and they helped me out and they found me housing and they found me this and they were awesome. Great community over there. Shout out Minnesota. But you know, it was difficult, you know. You're not in your zone. This isn't your hood. This is not your turf. You're not doing your stuff. So it was hard. It was. And then coming out of there, actually the best thing was that I was like, okay, I got to put my stuff in check. Like I got to make sure that I'm doing things right. Over the next couple of semesters, I did okay. Like not too bad at all. And then I think it was my second year that I was like, I really want to look into this component of like sports physical therapy, because you're talking about I'm a physical therapist and I'll kind of explain like the specializations that come under that. But I was like, I really want to become a sports physical therapist, because what happened in our specific curriculum was how PT school worked was that you had the first 2 years were didactics. So you had your courses,
classes,
whatever,
everything.
doing everything there. And then your third year was clinical rotations, and you had 4 altogether. So for me, I just got to get through the didactics, go through the clinicals, and then
You just
become a
apply
physical
what you
therapist.
learn.
Basically.
Right.
Basically. Other programs could be different, so they kind of like sprinkle out their clinical rotations everywhere. So my second year, I was like, I want to go into sports. So then I started talking to my advisors and some people in the program, and I was like, hey, if I want to specialize in sports, what do I do? We had just hired someone in the research lab or something like that who is a board-certified sports physical therapist. And I was like, ooh, that sounds cool. I want to go down that track. So then I was like, okay, let me get in contact with this guy. And I remember the story. I think it was middle of my second year. I was like, I really want to do sports. And I sent this guy an email and was like, can I meet with you? And he was like, yeah. The same day that I was supposed to meet with him, I was on, like we were just shadowing inside of a nursing home. And I finished that day and I had a major headache. Had exams, had studying, finished at like 7 p.m. and all these different things. And I basically emailed him and I told him, like, dude, like, I'm really not in the mood. I can't talk. Like, I just have a major headache and we have exams coming up and things like that. Can we reschedule this? And he was like, okay, that's fine. Rescheduled it, went into him. And then he kind of looked angry at me when I walked into the office. And he was like, if you want to become a sports physical therapist, you can't do things like that and you won't be cut out for it. And like Michael Jordan said, I took that personally. I went from there and I was like, he basically told me I'm not cut out for sports physical therapy at all. Like I won't last a residency.
Because you canceled out on him?
Yeah. Because he said there's going to be long days in residencies and sports and you're going to be doing all these things. And he was like, you're not fit for it, man. I don't know what was going on. Like, I don't know if I just didn't put on deodorant that day or he just didn't like my smell or the way that I looked or whatever. But he was really giving it to me. And I was like, okay, this is a kick in the butt. Okay. From then, my third year, I applied to 5 sports residencies. And yes, there are residencies in physical therapy. I got 4 out of 5 interviews at big schools, like big programs. And I also ended up with 3.8, 3.9 GPA. So going from academic probation, then almost failing neuroscience, to talking to this guy, and then finally getting on to becoming a sports resident. So
that's awesome.
Yeah, reflecting on that stuff, it's actually really cool to think about. Like, you did that, dude.
Yeah.
By the grace of God, but you did that.
Yeah.
And it's pretty sick to think about it. So, yeah, amazing journey. And I went on to the University of Rochester Medical Center. That's where I did my sports residency. And for PTs, that's optional. So you don't have to do a sports residency. And there's many different specializations you can do. And there's 2 main tracks you can do in order to become board certified in whatever it is. So it's board certified sports, board certified orthopedics, board certified neuro, all these different specializations that you can go into. And most of them have residencies that come along with them. So there's 2 ways that you can get them. One is the accelerated path, where you can do an accredited residency, and then at the end of the residency year, you can sit down for the exam. If you don't do that track, you just have to accumulate a certain amount of hours in the clinic to be able to sit down for that exam. And I think someone told me before that it equates to, I think, 4 or 5 years worth of hours in the clinic. So I did 1 year of residency versus the 4 or 5 years to go down that track. So finished the residency. It was an amazing time, really specialized in a lot of stuff. It was in a hospital system, so I saw everyone and anyone. It was also 2021, the year of 2021. So right after COVID, and like we were supposed to do a ton of different things with them, man. We were supposed to go to the Buffalo Bills camp. We were supposed to work with masters in golf.
Oh, that's right. You're up there in Rochester.
Yep.
Yeah.
We're supposed to do all these different things, but we never ended up doing half of them just because of COVID, which sucked. But I still got the experience that I needed, I saw a ton of ACL stuff, which is what I specialize in right now. And yeah, it was a great time. Finished that residency year and then took the exam, sat for the exam, passed it. Thank God. It was a very tough exam, but honestly, it was amazing studying for it. And then, yeah, from there, I became a board certified sports physical therapist. Also, during that third year that I talked to you about, where you have 4 different clinical rotations,
Right.
I took another certification exam, and this is the certified strength and conditioning stuff. So I not only wanted to get the physical therapy aspect of things, I wanted to see the strength and conditioning side of things. So more of like performance and how to get athletes back and that kind of thing. So I took that certification exam and actually almost failed it, the second portion. Again, a couple of questions. I don't know why this keeps happening to me. But yeah, when people ask me for my credentials, what I am is I'm a board certified sports physical therapist. And then I'm also a certified strength and conditioning coach.
Say that 10 times faster.
Yeah.
No,
Yeah.
that's awesome, man. I'm so proud of you.
Thank you.
I'm so proud of you.
Thank
I
you.
don't think, I mean, we have a lot of physical therapists in our community, and, you don't really, like, I know what a physical therapist is. You know what I mean? But you don't really see what they do on a daily basis. Like, somebody had a car accident, pain in the lower back, radiating to the left leg. Let's probably sciatica. Let's do some movements, But I didn't really know that you had different specializations. I thought the physical therapy is just a physical therapy. Like, it's the same thing for everybody else.
One of the biggest pros about physical therapy specifically is that I don't need to specialize in a certain field in order for me to work within that field. So, for example, if I am a sports physical therapist and I want to go work with children and do pediatric physical therapy, I can do that right now. I can do that tomorrow. Not many places would hire me because I don't have the experience with it, but I can do that. It's within my scope. But if you're a physician, for example, I can't go from an anesthesiologist to become a surgeon right away.
Right.
So I can hop within different fields, and that's what a lot of people do within the realm of physical therapy itself. And it's really nice. It's one of the biggest pros with it.
So then what is it that you do more in sports physical therapy that you wouldn't do in regular physical therapy?
Yeah. So when people think regular physical therapy, they're talking about orthopedics. And what in the physical therapy world what we call it is outpatient orthopedics. So outpatient just means outside of the hospital.
Right.
And then orthopedics is just like literally anything from a hip or knee replacement to maybe a sports injury or maybe a concussion, vertigo, vestibular issues. You had an ankle sprain, literally anything within that spectrum. And I think that's actually one of the downfalls of physical therapy, because you expect physical therapists to know so much about so many different conditions. So when it comes to actually treating them, are we actually getting good outcomes with them? Not really sure about that. And that's why I have this vision in my mind where one day my big dream is to be able to open up a clinic where you can come in, and it's either sports or orthopedics, whatever you want to call it, and be able to say, okay, Kero specializes in knees and knee injuries, and Joe specializes in shoulder injuries, and Samantha specializes in whatever injury, so that whenever you call the front office and be like, hey, I want to go and see this specific person, you can go for that specific joint because they are an expert in that joint. And I don't think anyone has that out there. But when you go and search like a surgeon, they'll say they specialize in shoulder and hip, or hip and knee, or whatever it is. And they do a lot of work within that field. But for us, it's just such a broad like casting net that you have to really catch. And it's not, I don't think it's it.
Yeah. Well, I mean, I see, like, the thing is, like, I know a lot of people that have gotten into accidents or injuries and whatever, and they refuse to go to PT. Right, because it's not gonna do anything. Like, it's insurance. You have to get a PT before you get an MRI and stuff like that. And and I think, like, I have somebody I know that injured himself playing soccer, and his ankle would swell up, and I was like, dude, just get an MRI. First thing you do, just get an MRI, because otherwise, how are they gonna know what they're treating you for? You know what I mean?
Yeah.
So it's like sometimes people just don't want to go to PT because they just feel like it's not going to do anything. Like, is that true? Like, is like, there is some stigma going around it.
Yeah. No. I'm here to dispel those stigmas. Hopefully.
Yeah.
So a couple of points there. Number one, in New Jersey specifically, we have something called direct access, which means that you don't need a prescription to go to a physical therapist. So you don't need you don't need a script from a physician in order to come to a physical therapist.
So if I'm having, like, pain in my shoulder right now, I can just book an appointment with you and be like, listen, my shoulder is killing me. Can you figure out what's going on?
Correct. You can do that in New Jersey. And many states are kind of following leader on this. And I think that's really good because think about it. Physical therapists are movement experts. We're supposed to be movement experts. We're supposed to understand how you move, and if you are in pain, how we can alleviate that pain. Okay? If your back gives out, for example, and you go to the ER and you stay for hours and hours and hours, and they take the x-ray and they say, sorry, we couldn't find anything. And they just send you home with medications. And what happens after? You go to your primary care doctor, and your primary care doctor looks at you, checks your cholesterol, do some blood work, and asks you a couple questions and whatever, and is like, I don't know this. And then they send you over to pain management, and then pain management or orthopedics. They'll be like, yeah, we're not really going to do surgery on this specific thing. And then what happens from there? They send you to physical therapy. So why do we have to go through all these middlemen? Why can't we just go to physical therapy right away? We learn in school what the red flags are. So if I think someone has a tumor in their back or something serious is going on, we learn how to screen for those. I'm a doctor of physical therapy, so I have my doctorate. So I understand how to screen for those things. So if someone comes in and they're like, I'm having this, and I ask them, do you have a history of cancer? Do you have a history of smoking? Do you have any bowel and bladder issues? And they do have that stuff. And I say, okay, maybe this is not for me right now. I need you to go make sure that something serious isn't going on, rule that out, and then come back. Instead of going through all these different physicians, paying all this money and doing all this stuff, just save all that time and just have them go to a physical therapist. We can be primary care providers.
I did not know that.
Yeah.
So, but is it covered by insurance?
The direct access? Yeah, absolutely. At least in most cases. From what
I didn't. This is the first time I'm hearing about this right now.
Yeah. This is all.
Like, this is like news break for me. I did not know this.
Oh, this is all real stuff.
So I can just call you right now and be like, hey, listen, I need you to look at my shoulder. Done.
In New Jersey, yeah. Some other states, you can't do that.
No authorization. I can just go in right away and just get it done.
Yep.
No, I mean, New Jersey's doing something right.
I think with Medicare, so with specific insurances, Medicare meaning the older people, they require some sort of signature on a plan of care. So that means when I sign my documentation and I send it over to their primary care, whoever referred them over, or just their primary care in general, because they're coming direct access, they have, I think, 30 or 60 days to be able to sign off on that specific plan of care. But those are specific insurances. But for the most part, there is direct access to physical therapists in New Jersey.
That's pretty cool.
Yeah, it is pretty cool. And people don't utilize us. Again, movement experts.
I don't think people knew about it. I mean, at least myself. I mean, I've been in healthcare for, I don't know, like 15 years, 16 years. I never knew that you can just go to physical therapy with that. I thought you had to go see a doctor and then they refer you to a physical therapist.
Nope.
Well, that's pretty cool.
Yeah.
So your vision is to open up your own spot with multiple different specialties, like, the shoulder specialist or, hip specialist, whatever, or lower extremity specialist.
Again, that's years down the line, but yeah, I have a vision for that. Yeah.
Yeah. So right now, what is it that you're doing right now?
Yeah.
Because I see your videos popping on my Facebook every single day, and I love it. And thank you for putting in captions on your videos.
Yeah.
Because I'll be in meetings on my phone. I'll be like, oh, that looks pretty cool. So what is it that you're doing right now?
Yeah. So to continue on my story, so I finished at the University of Rochester Medical Center and got my SCS, which is the sports certification specifically. Finished there, got out, and was like, I'm a young guy, and I got all the letters after my name, and I can just rock it over here, Yeah. And at first I thought I was going to become the physical therapist for the Giants or the Jets or the Nets or any of these sports teams in the area. But then once you get married, you realize, you can't do that because you can't travel all that much. So then things change. So then I got a job.
Wait, do you have to travel if you're like
if you're a physical therapist? Yeah.
I thought you'd be in a training facility.
Yeah, you are there, but then you have to travel with them. So when it comes in season stuff, there's a lot of stuff that you got to do. You're traveling with the team, long hours, 80-hour weeks. It's a lot of stuff.
I thought you'd be just in the training facility. That you go play their game and come back, and then
nope,
you're there to take care of them after.
No.
Okay.
The biggest thing about physical therapists in these professional leagues is that they are physical therapists, so they're dual credentialed. So they're physical therapists and athletic trainers, and there's a difference between the two of us. Athletic trainers are really, really good at diagnosing acute stuff. So if you fall down on the field for whatever reason, It could be an ankle sprain, or it could be you tore something or whatever it is. They're really good at being able to diagnose whatever happened and kind of triage what's going on here and send you to the proper person, maybe tape you up or whatever it is, give you a couple things here and there. Just make sure that you're safe in order for you to go back to the game. They do have some background in rehab. So you'll see athletic trainers, they do rehab some people, but they don't have the extensive knowledge. I mean, this is not on everyone. So any of these athletic trainers that might come up to me and be like, yeah, we do have the knowledge. No, I've learned a lot from athletic trainers themselves, but we have that doctorate, and there are doctorates of athletic trainers now. I didn't even know there's DATs now. They can become doctors too. But anyway, so they're dual credentialed in these professional leagues, so that you're not just acting as a physical therapist, you're also acting as an athletic trainer out on the field. So you have to be dual credentialed. I think it's in the NFL and the NBA, where you have to go out, and if someone goes down, you're out, you're checking out their injury, doing that stuff. Whereas physical therapists, they're mostly trained in the rehab portion of things. So things are slow, you're in a clinic, you don't have to make like split-second decisions, you don't have to do any of that stuff. So that's kind of the difference between the two. And the reason why I went into my residency sport specifically is that it kind of married the two. So I got that experience of athletic trainers, and I was actually under an athletic trainer during my residency. So I was paired with a local high school, and I would follow her around, and she taught me a ton about all these acute injuries. And then that's also with the knowledge that I have in the clinic of physical therapy, and that's why I got my SES, or the specialty in sports physical therapy.
Cool.
Yeah.
So you were saying that you wanted to be like a trainer for the Jets or Giants.
Yes.
And then you got married.
Yep.
Yeah, and then I asked you, go ahead.
So then I got a job up in North Jersey, and I was there, and the boss over there promised me a ton of things. He was like, we're going to make our own NFL combine prep, and we're going to do all these different things. And I was like, yeah, I'm young, I'm ready to go, let's do it. Just got out of residency, this is a great job, awesome, getting paid okay, let's do things. 6 months into this job, things started to kind of fall off a little bit. Promises weren't being met and things like that. Basically what happened was he was contracting inside like nursing home facilities. And he basically told me, hey, we have like a physical therapist who's not going to be here for this nursing home. Can you go and just like cover? And I was like, okay, I'm a sports physical therapist, but okay, fine. Let me just go in and cover. So I covered 1 week, became 2 became 4 became 6. And then I started asking questions, and I'm like, why am I doing this? I should not be doing this right now. I should not be covering. I should be inside of the performance facilities. And that's where I was originally. But he was like, oh, you don't have many patients on your caseload and things like that. We're trying to build things up, but, just cover there for now. And basically I went into him and told him sometime in July, this was 2022, I believe. And I told him on a Monday, I was like, hey, I think it's best if I just decrease my time to part-time here, so you don't have to pay me as much and don't have to invest as much money into me. And I can go kind of follow my passion and do something else. So I'd like to decrease to part-time. So I'm not full-time anymore. He was like, all right, let me think about it. That Friday, he was like, come into the office. I had patients on my schedule, and he handed me a letter of termination. And it was like, peace, I don't need you anymore. And this was a couple months before I got married. So I'm like, oh, shoot. Yeah. Where do I get the money? What do I do? This is going to be a rough time. I have no idea what I'm supposed to be doing now. So milked the hell out of unemployment for a little bit. Did some home care physical therapy just because I had to, and it was good money. Got married. And then from there, I signed on with a cash base. So the stuff that I was doing before was insurance-based, all insurance-based stuff. So I signed on with a cash-based sports physical therapy place. And I was like, oh, this is going to be great. They were kind of trialing me out. So in the beginning, they weren't really paying me that well. But I was like, okay, let me just see what's going on here. So I trialed with them, whatever. And then me and Clara, my wife, we started going to CrossFit near us. Started working out over there, and there's a PT inside of there. So then I met that PT, and then we're like, okay, this is kind of cool. We're actually both Coptic, and like, let's talk. Like, we seem like we kind of have similar backgrounds. He's a little bit older than me, has more experience than me. Let's do this. So we went out for coffee, and long story short, we were supposed to become business partners, but that kind of fell through. And then he basically told me, why don't you get a little bit more experience in terms of business itself, so that if we ever do merge or become business partners or open up a clinic or do whatever eventually, you understand the ropes of business. So I was like, okay. So I started looking for a business coach and this whole ordeal he told me to do. And then I landed on the specific business coaching that allowed me to do this online stuff. And I was kind of skeptical of it at first. I was like, I don't think this is the thing right now. But because we just had the pandemic, I said, okay, let me just give it a try. Let me see what's happening. And I talked to Clara, and I was like, what, can I do this? Do you think I could do something like this? It was a large sum of money that I had to put down in order for me to start this business and to start with this business coach. But she was like, if this is your dream, do it. Just go for it, even if this is just the beginning. And she was great in supporting me. So I ended up paying a large sum of money and started this online thing. And basically they tell you that they want you to niche down very specific in terms of like specialization, the specific target audience that you want to work with. And that target audience for me was ACLs. The reason why I picked them is because I went through an ACL injury myself years back. So I told myself, this is it for me. There was a ton of other people in that same field, and that kind of like gave me the heebie-jeebies. And I was like, if they're doing it and they're doing really good, they're making really good money, then there's no way that I can. There's only a limited amount of people who tear their ACLs per year and that kind of thing. But I ended up doing it. Over the course of several months, I was like, okay, I really missed the in-person stuff. I was only doing the online stuff. And at that point, I had quit my cash-based job. I was quitting everything. The only thing that I was doing right then and there was building the online business and then doing some home care on the side just to kind of make ends meet. So I did that for several months, and then I missed the in-person stuff. A couple of weeks during that time, I also did some shadowing at Rutgers University. So I was working with their like Division I athletics, was shadowing under their director of rehab, and was doing a lot of stuff over there. And I missed the in-person stuff. So then I decided to start looking for spaces and started to do stuff. And then the same guy who's supposed to be my business partner from before, that same person came up to me and said, hey, I'm leaving a space in Princeton. Why don't you try and come check out this place and see what it's all about and see if you can do in-person stuff over here. So okay, let me check it out. So I talked to the owner, went to the gym. It's a small gym over here, boutique, not very big at all, but it had all that I needed. So then I was like, okay, let's do it. It was cheap rent. Let's just start and see what happens. Kept on going with the business coaching, but to be completely honest, I didn't really have good clarity of what I wanted to do. I really wanted to work with ACLs only, but I knew at that time I couldn't really do that because I didn't have that kind of clout in the field just yet or in the area. Not many people knew about me. Not many surgeons knew about me. They didn't really know what kind of outcomes that I can give. So it was very unclear. And then on social media, it was unclear. So I kind of was naive in terms of, oh, I could do this and the online. And I was kind of building up two businesses at the same time and didn't know what I was doing. So I was like, okay, I cannot do this anymore. And I basically just clear cut was like, which one is making me more money? Which one is more profitable? Drop the other one. That's it for now. So then I ended up dropping the in-person stuff, left that space. And I started looking for a part-time job. And currently what I'm doing is I'm working for a hospital system up in Morristown, just part-time, just to be in the clinic and do some stuff over there. And at the same time, I'm still doing the online ACL stuff. And the online ACL stuff is really doing well. And I've learned the ropes of business, and I'm not perfect by any means at all, but I'm starting to really understand what it's like to be in the online world and how successful this actually can be for people. Especially because now we live in a world where there's so much information out there and care is just not where it's supposed to be, man. It's not. I mean, I've treated ACLs I've done some research in grad school about the psychological readiness of return to sport after ACL injury. And I told you I did a lot of ACL stuff during my residency. Yeah. And then I did some stuff afterwards as well. So for me, I was seeing all different types of like insurance-based, cash-based, where like what is missing here. And that's where I've kind of formed this program of understanding that people need the ability to do things on their own and the ability to have information consolidated for them in one area where they have a coach that's kind of bringing them through the process. And I've seen really good success with it, man. Really good success with it. Better than in-person stuff.
So when you say your online stuff, right, like you're posting the videos, and then let's say a patient of yours is watching the video and doing what you're telling him to do or her to do.
Yeah. So basically how it works is that it's not just, hey, pay for my program. You pay this amount of money, you get access to the app, and then you just have a random program.
So
and
you have
just
an app.
Go. So it's not my app, but it's branded with my stuff.
Right.
Yes.
Okay.
I have an app that's branded with my stuff. And basically we hop on a call together and we figure out, okay, can I actually help you to begin with? Is this a situation where I can help you?
Consultation.
Yeah. And most of the time people are just like, insurance ran out. or my PT doesn't really know what they're doing, or they're a new grad, or I am 9 months out and I just don't feel like I'm ready to get back to sport, 12 months out, 18 months out, whatever it is from surgery, ACL surgery. And they come to me and I say, okay, let's really break this down and figure out what's missing here. If I can help them, then what I do is I kind of pitch them my program. And from there, it's programming, it's communication, it's weekly check-ins, it's accountability stuff, it's exercises with sets, reps, videos, pictures, descriptions. Everything is inside of the app. So I make it as easy as possible for people to just open up this app, click on their dashboard, and say, okay, I have this, this, and this to do today. Once I finish them, click it off, and then I'm done. Don't have to worry about anything else. And I have clients all over the world, man. People from Australia to London, Scotland, people all over the United States, Colorado, Boston, California, Florida.
That's
all over.
awesome.
Yeah.
Do you think this is where the future of PT is going to be
I think so.
for the majority of patients?
I think so. I don't think that this kind of remote stuff is for everyone. I don't think so. Especially for people who are really fearful or fear avoidant and just can't move in certain ways unless they have specific eyes on them or some hands on them or anything like that. And there's also the people who can't deal with technology. They don't understand what it's like to be on a phone or whatever it is.
Yeah,
I
I was
mean,
going to say that too.
those people are starting to kind of phase out a little bit more. But these generations now, they do know how to use tech. And that's everything. Ever since COVID.
I was
Again,
just going to say COVID played a part of it too.
yeah, it played a huge part because I truly believe that I was skeptical at first. I told you. I was like, this is not going to work out. What do you mean? Like I have to get my hands on this person and I have to see how they're moving and what if they have some sort of deficit or, but then I realized they can just send me videos. I could slow-mo it and then I can figure out exactly what's going on. If anything, I could see it even better on slow-mo. So yeah, this works.
But see, that brings me to the other point is that, a patient is going to send you a video of them moving or, limited range of motion or whatever it is. Wouldn't it be better to see it in person, to see the actual motion? Like, do you think that maybe like seeing a video, would kind of mask something that otherwise will be there if you're there in person?
Yeah, so that's a valid point, and I take measurements in the beginning. So there are a ton of extensions and AIs and things that do really amazing
You have
things
them take
nowadays.
measurements of what, like their, like how far they can extend their arms?
So
or?
it's all knee stuff. So
Okay. I'm sorry, knee stuff. Yeah.
Yeah, so what I have them do is everything is completely standardized. So I have them against the wall, and I have an extension on Chrome that allows me to measure their flexion and extension. So flexion meaning bending.
Okay, that's
and,
pretty cool.
And their extension being able to straighten out their knee. So I understand what their flexion and extension is compared to the opposite side. So I see, because that's one of the main pillars that we work on in the beginning in terms of rehab.
So you get a kind of a baseline
Exactly.
to work with.
Exactly. And then in terms of their strength, there's measurements that I have them do over there. It's very objective. It's not just like, oh, you kind of look good. Let's get you back out. No. It's very objective, and I make sure that we have goals. We have objective measurements. We test every so often. We make sure that everything is reliable and as valid as possible. Is it the gold standard? No. Not close, but
It's going to get better.
it will. It will.
It's not going to stagnate, and it's going to continue to improve.
But I truly believe that some of these measurements that I'm taking are actually better measurements than some of the ones that the PTs are taking in clinic for these people.
Why?
Because, for example, one of the major predictors of a second re-injury is if you have a lack of quad strength. So your thigh muscle, if there's not a lot of good muscle there, truly in the quad muscle, then you have a higher risk of re-tearing, either on that side or on the opposite side in terms of an ACL injury specifically. So in the clinic, how people measure that is what you learn in school. It's something called manual muscle test. And what that is that basically the PT has you sit on the table and they have you kick out into their hand. Okay? But for example, if the PT wakes up on the wrong side of the bed, or if he just had a fight with his wife, or if something like that happens, that is a very subjective understanding of what their measurement is. And it's rated out of 5. So if they're able to bring up stuff, their limb up against gravity, it's a 3+ out of 5 automatically. But then we have 3+, we have 4-, we have 4, we have 4+, and we have 5. How do I know the difference between a 4 and a 4-? How do I know the difference between a 4+ and a 3+? It's all subjective. It's all just push into my hand and 3+, 4 minutes. It's very subjective.
So it's not accurate. It's like from one PT to
Correct.
another.
And this we learn in PT school. Basically, it comes from people who have had strokes, Parkinson's disease, like all these different very low functioning people who can't do much. All that scale is able to tell me is, are they able to lift up whatever it is against gravity? And if they're able to push out as hard as they can against gravity, then they're a 5 out of 5. But everything in between there, I don't know.
Right.
I don't know. It's very subjective from PT to PT. So it's not a reliable measurement. I can't do that. And then there are some devices that are coming out now to kind of alleviate that stuff, but not many physical therapists will purchase those kinds of things. So I have people on a leg extension machine, because the leg extension machine, the one where you kick out, is the only reliable way to isolate the quads themselves. So there's no other compensations that are going on in the body. You're not using your hip flexor, you're not using glutes, you're not using hamstrings, none of that stuff. It's strictly quad if you set it up correctly. So then I have people basically go up to a 3 repetition maximum on that. And then they do that on both sides. I take a percentage, and I'm like, this is what your quad strength is. And there are other ways to do it, but this is the way that I kind of use it.
I like the leg extension machine.
I love it. Quads are king, man.
Quads are king.
Quads are king.
Yeah. I'm working on that right now.
Is it actually... I was looking at someone's post recently, and they were providing a reference that basically said that quad strength in terms of the geriatric population, so older people, actually has more of a predictive factor of longevity than grip strength.
Really?
Yeah. And I need to read that paper. I need to go into the depths of it and understand what's going on there. But now it's just proving my point that quads are kings.
That would be something, because I think now we have more, the fitness community right now is exploding.
Yeah.
So everybody is, for the most part, is working out,
Yeah.
So 50 years from now, we might have, quad kings and queens walking out. Walking down the mall on Sunday morning.
You just look good, man. When you have good quads, you just look good. You look good, feel good. That's what it is. I always preach that stuff.
Let me ask you something. So now with your ACL injury specialty and all that, what do you think is the number one sport that contributes the most to ACL injuries? At least from your clientele.
If I have to generalize right now, I would say that it's anything that we consider a level 1 sport. And a level 1 sport is anything with a high demand of cutting, pivoting, jumping. So change of direction, basketball, football,
soccer,
those kinds. Yeah, those kinds of sports. What I'm seeing currently is a lot of skiing stuff. So a lot of people with skiing injuries. A lot of people.
Now, why does it pop when you get an ACL tear?
Yeah, so the ACL itself it stands for anterior cruciate ligament. So cruciate, there's 2 cruciate ligaments inside of the knee that kind of cross each other, and that's why we call it cruciate. And basically what it does is it doesn't allow for the shin bone to go up on the thigh bone. So what we're doing there is that whenever you plant and then you go to twist, or you're just changing direction, or you're doing something too quickly, the quads can't protect that knee, and then all the force goes up through the joint itself. And when that happens, the ACL is the first to go. And sometimes you'll have other injuries. So you have meniscal injuries. You'll have an MCL injury, which is medial collateral ligament, which is on the side of the knee, lateral collateral, some other ligament injuries. But that's typically what happens.
So now when you do a PT for these injuries, does it matter how old you are when you get these injuries? Does it vary in terms of, obviously the younger you are, the quicker you're going to come back. But do you think now it's changing to where, we're kind of perfecting our methodology, and we can have everybody come back as soon as possible?
I would say we're not perfecting our methodology whatsoever. And if anything, the injury rate is actually increasing right now, and we have no idea why. There's so many different factors that go into an ACL injury itself.
Like what?
So I want to say that this research shows that there's up to a 20 to up to 30% actually re-tear rate when it comes to an ACL injury. So if someone has an ACL injury, they have reconstruction, and then they re-tear up to 30%, which is actually wild. When we look at like other parts of the body, like the Achilles, for the example, if you tear your Achilles, get surgery, and the re-tear rates for that are 10%, less than 10%, and that's okay. We don't want it to be at 30%, but there's so many different factors that go into it. And most of the people who tear are typically like younger female soccer players. Those are typically the people in the research that are like, they tear all the time. They're most at risk when it comes to this specific type of injury. There really is so many different factors. From the females they're aversive to lifting in the gym because as they grow up, if you lift a weight as a female, you will bulk up and then you will look like a man. From factors like that.
That's a myth.
Yeah, exactly.
That's a myth.
Absolutely. So they don't know that, but the coaches, they'll say that, or the parents would say that, or their peers would say something like that, and then they never get into the gym. So, but compared to men will actually get into the gym pretty early and do their thing. And for them, it's like, yeah, get yoked, bro. You know? But for females, it's not like that. Like no one really says that. So factors like that, to anatomy, pelvic angle, to the way that they prepare for their sport, to specialization. So some people, they'll play soccer all year round and they'll play too much soccer to the point where they get fatigued. And then their quads are just like, I'm giving up right now. So they're not king anymore, queen. And then they tear. So there's so many different factors that goes into this specific injury. And right now we're just not very good at understanding why or how. And the re-tear rate is still pretty high.
Are we not drinking enough milk? Like, I feel like we're not drinking enough milk.
Just tell everyone to drink Fairlife and they'll be okay.
Just drink Fairlife. Actually, it's sold at a BJ's, and I'm so pissed off right now because I have to buy the other one. What is it called? Premium.
Premier Protein?
Yeah.
No, not a big fan. I love Fairlife.
I'm not a big fan of it either. I just, I went to BJ's the last month and I bought 2 because they literally put limit 2 per customer. So I just got 2 boxes.
Yeah.
So this is my last batch. And so we were restocking, and I went, and they're sold out, and I'm just like, you can't get them anywhere.
I am telling you, every single time my wife goes in to any grocery store, she buys probably anywhere from 6 to 8 of those bottles of Fairlife to put in our fridge at one time.
Yeah.
Because I literally go through one every 2 to 3 days. Yeah. I drink them just straight out of the bottle. I have all the different brands.
30 grams of protein.
You can go up to 42 with the new shake that they have.
Which one?
They have one that's 42 grams of protein in it. It's amazing. And it tastes so good. And I keep telling Clara that if I ever blow up on social media, Fairlife is the only person I'm going to take as a sponsor. So Fairlife, if you can hear this right now, sponsor me. I have so many of your products. I should basically invest in your stocks.
No, I have a lot of Optimum nutrition products, like a lot.
Yeah.
Like, this is what I've been using since I started. So I like their products. They're pretty good, but I feel like I feel like a lot of people are not taking protein seriously. They're not taking their health seriously. One of the things that I regret the most is I didn't start working out as young as I should have. You know what I mean? And I'm not talking like I'm a grandpa, like back in my day, I'm not doing that. But at the same time, it's like, if you're still in your 20s, go to the gym.
Yeah.
If you're still in your early teens, go to the gym, work out. I'm not a PT, but I read online, and you can, fact check me on that one. But I read online is that in order to protect yourself from injuries, you need to not be yoked, but you need to have good muscle mass.
Absolutely.
To protect the tendons and the ligaments that you have. Is that true?
Tons of research to support that.
Okay, so I'm not making this up.
Absolutely not.
Awesome. So it's like, I feel like people, I feel like the generations now, we spend a lot of time inside. We don't really go out as much. It's a lot of video games, a lot of social media, a lot of screen time, and we don't really touch grass, So it's like when I was younger, during summertime, we used to go out and play football. Next to my house, we used to go to the park with my friends and play football every single day during the summer. We didn't have a job. I was still like 12, 13 years old.
Yeah.
now parks are empty. You know, people are not working out. People are not playing football. People are not, you know, doing stuff in groups or whatever. So I feel like nobody's taking their health seriously.
It's so sad, man. It's so sad. And to go back to your point, I don't think that people actually need to get into the gym. I just need them to
Just
exercise.
be active.
Just do anything.
Yeah.
I think nowadays we have phones and TikToks and all these different avenues where people can stay inside, so they have no reason to go outside. And we're declining in terms of health overall. And so people ask me, they're like, I want to start running, or they ask Clara because Clara's a runner. They're like, I want to start running. I want to start doing stuff. I want to start lifting. I want to start this. I want to start that. And I tell people it's literally just a 3-step process. It's do it. Just do it. Some people are asking me, what type of shoe should I have when I go into the gym? It's just like, my guy, it doesn't matter if you go barefoot. Just get into the gym. Go
Only when
move.
deadlifting, you should be barefoot.
It
but
doesn't
yes.
matter what it is. Just do it. So step 1 is just do it.
Yeah.
The second step is do it more. And then step 3 is do it better. I didn't learn all of these different things. Like, I didn't do all these different things just because I went to PT school. It's because I tried it out myself. Like,
Right.
I work out right now. I'm in a program. I have a coach. I have things that I'm doing right now. And I've been in the gym for years and years and years.
So even as a PT, you have a coach?
Yeah.
Why?
Yeah. I mean, this one is free, but shout out Carmine. But it came at the at the right time. So for me, I was kind of programming for myself. So I was doing my own things and I was programming and I was like, these are my goals. This is what I want to reach and whatever it was. And at the same time, I was on Instagram and some guy who is a performance coach at a gym in Freeholds was like, I'm hosting this 4-month program, transformation program for people, and it's for aesthetics and to get yoked and to do all these different things. And I don't like when just personal trainers do that because I feel like it's just a lot of fluff. Like, oh, just try this free program out and we're going to give you all the results and all this stuff. And there was an application process that you had to go with this guy. So I was like, okay, let me apply and figure out what's going on. And it's completely free. So I was like, all right, let me try and see what's going on here. So I got on the phone with this guy and we were talking back and forth about muscles and hypertrophy and growth and doing this and that. And he's telling me about this research and that. And I was like, this is it. This is what I want to do. And dude, my transformation, I'm only 2 months into the program right now, has been absolutely crazy. It's been absolutely crazy. I got to show you pictures after this, but I love it, man. And Fairlife has been a big part of that. Big part.
Yeah. I mean, I think... And creatine also.
Yeah, creatine for sure.
Creatine is a big one.
But again, what I'm saying is that like people they're majoring in the minors. So they're focusing way too much on
just do it.
Why are you so focused on the type of shoes that you have and the support and the what if I don't have wrist straps and what if you're not going to lift heavy enough weights for you to need wrist straps.
Right.
You don't need that stuff. Just get into the gym and try. Just explore. Just see what happens when you go over to the cloud of testosterone that is the free weight area. Just do that. Yeah. Do that first and see what happens.
I've seen people coming in the gym in their pajamas. You don't need to have fancy schmancy stuff. Just get in there and sweat it out.
Exactly. And then people wait till it's very, very late where their health, I have friends, 28, 30, 35 years old that are like, we're making fun of you because you exercise and do all this stuff and you run and whatever. But then they go to their doctor, they take blood work and they're like, oh shoot, like, dang, I'm nervous now because I can't do anything. My cholesterol's super high. My doctor's telling me I'm going to shave 10 years off my life because I can't do specific things.
Or I'm going to get you out of breath.
Exactly. So then they come back and they're like, oh, so, what do you do? Tell me about the things that you do.
Actually, there's an Egyptian guy I think he's from Canada. The west side of Canada. I don't even know what it's called. His name is Bishoy Kella.
Yes, I know him. He has a ton of followers. Yeah, yes. He was like 300 plus pounds and he lost all that weight.
I'm gonna see if I can get him on the pod.
Oh man, that would be great.
Because he's one of the reasons why I started working out again. Because of him.
He's great.
I was strolling on TikTok and then I see his video.
Yeah.
And it's Bishoy Killa and I'm like, that name is Egyptian.
Yep.
Right?
Yep.
And I click on his account, and then I look through the videos that he has, and where he does like 75-day hard or 75 hard, which is like 75 days straight of working out every single day.
Yep.
And I follow him on Facebook too. And he's out there like he just ran like 35 miles the other day around his house. Like he just ran 35 miles. 6
I saw
hours.
that story. Yeah.
And like what a transformation. you know, the guy went from a party king or whatever, and you know, drinking and eating unhealthy and all that, to six pack and just running marathons, and he's like prepping for his first
ultra marathon, right?
Something like that.
Yeah. He's the Coptic David Goggins. That's how I.
And I'm just like, dude, like I would love to have like, and because I watched his video, and I'm like, what am I doing?
Yeah.
You know, like what am I doing in my life? Like why am I not like that?
Yeah. People see stuff like that, and I think it's great that guys like him are all over social media, and I really praise him for what he does. Like it's true, like respect, man. True. But I think people see something like that and they become motivated, quote unquote. But then when they fail, they become more of a victim. And they're like, I can never do this. I can never become skinny. I can never be healthy again. I can never do any of that stuff. And that's when people truly just don't want to do fitness at all. So it's
because they expect immediate results.
Right.
You can't expect immediate results.
It's not. And people think that they need to do the craziest of things. And it's so cliche for me to say, you just need to start with the small things and just stay super consistent with them.
Beginnings.
It's all about discipline. It has nothing to do with motivation. Motivation fades and it comes and goes. And you can watch all the motivational YouTube hoorah videos on YouTube. But then if you don't have the proper discipline, you're not going to stick to it. You're not going to see any results, period. It's just the end of that. And I've been listening. So I kind of have like a guy in each category. Like if I want to learn more about like muscle growth, for example, I have a guy, Andy Galpin. If there's stuff about nutrition I want to learn about, it's this guy called Lane Norton. He has a PhD in nutritional sciences. And when it comes to nutrition, I go to this guy in terms of resource for that stuff. And time after time after time again, he always says that the best diet is the one that you are going to stick to. I don't care if it's keto. I don't care if it's paleo. I don't care if it's intermittent fasting. I don't care if it's cutting out calories, low fat, high carb, low this, low that, high this. Doesn't matter what it is. It's what you're going to stick to. That's all that matters.
That is true. I did try keto 2018, and I lost like 50 pounds.
Yeah,
from keto.
I believe it.
And I loved it because, you know, I was in really good shape, but I miss macaroni bechamel too much.
I would too, man.
I cut carbs out, like, you know.
It's hard. It's hard.
It's very hard. And then it was the complete opposite.
It's not sustainable.
No.
And I think people don't experiment long enough to understand what is sustainable for them and what's not. So they don't do things long enough to be like, ooh, that doesn't work for me. But this does. Switch to that thing. It doesn't matter what it is. It doesn't matter. It doesn't matter. So I have people who ask me like, dude, like I just want to like get into the gym and I want to start doing some stuff and whatever it is. I'm like, just go into the gym and start with 3 machines, 3 to 5 machines. Just get on the machines. And the reason why I like machines is because they don't vary as much in their range of motion or the degree of the range of motion. So they don't have different degrees in terms of what you can do with like dumbbells. So there's less injury risk for those. So just get into the gym, pop some weight on, and just do something and see what happens. Give yourself proper time to recover and get back into the gym and do it again and see what happens. Start exploring with your body. Ooh, this hurts this position, or I really feel the stretch on this position. Start doing that self-exploration. People don't want to do that. They're like, I just want the quick fix. I just want to do this something quickly. And I think it's really sad. I think it's really sad because you're not giving your body a chance. You're not giving yourself a chance to be like, I did this. I did that. And when they do something that's super quick, I've had several people who just come back and it's not
just
sustainable for them, and then they relapse significantly. So if you lost 50 pounds, for example, like I've had people who lost 30 pounds, they gained 50 pounds.
Yep.
It happens all the time. And I don't know why specifically with keto, because it's just so abrupt. It's so cold turkey, like no carbs.
I mean, it wasn't zero carbs. It was like, I think it was, if you're doing extreme ketosis or something. I forget the actual term, but it's like you have different variations. So if you have like intense ketosis, I'm definitely ruining the names, but whatever. It was like under 15 grams of carbs a day, and then you have moderate up to 25 grams of carbs a day, and then whatever. It's like 50 grams of carbs a day. So depending on how many grams of carbs you're consuming a day, that's the level of keto that you're doing. So I was doing the extreme.
Yeah.
Which is like a piece of bread. But again, it's not sustainable because, I was eating everything I wanted to eat, but without the carbs. I would have a burger without the buns.
Yeah.
I would have meat. I would have, chicken, eggs, bacon, a lot of high in fats, 0 carbs. And it worked out for a while, but it's just not sustainable.
I really have nothing against any of these things at all. The only question that I ask people is that going to be sustainable for you? That's it.
Yeah.
If they say no, then why are you even doing it? What's the point? You're just going to gain all the way back.
So what are you eating?
Literally, no joke. Last week, I had the most amount of sushi I've ever had in my life. One day. It's an 80-20 rule. So basically what I'm doing with this program right now is that our coach gave us kind of 3 ways that we can track things.
Mm-hmm.
The first way is you track all of your macronutrients. Everything. The second way is just protein and calories. Okay?
Macronutrients are what?
You have your proteins, your carbs, and your fats.
Okay.
The second way is just protein and your calories. So just your overall calories.
Okay.
And the third way is just looking at your portion control. Okay. So I said, I've always tried the portion control stuff, but it never really worked for me. And then the tracking stuff is just way too intense for me. Like, I can't do it. That's not sustainable for me. I can't sit there and track everything. For some people, it works. Great. You need that. I can't do that. So I was like, let me start with the protein and calories. And I started tracking them, like actually in an app. And I was like, I can't even do that. I can't do that. It's not sustainable for me.
True.
Yeah. So then all I told myself was that I want to get at least, because I weigh about 200 pounds, I need to get in 200 grams of protein every single day. And I just need to understand my portion control in terms of like calories and what I'm doing. And he has all these like methods. There's the FIS method for the protein, and this is how many carbs you should have and whatever. And I use that method. And as long as I'm 80-20 on that stuff, so 80% of the time I'm eating really, really well. And then 20% of the time I could do whatever I want. There was one day, literally 2 weeks ago, I had a baby shower or something. Or baptism or whatever it was.
Yeah.
And I really wanted cookies. I had one cookie and the cookies tasted amazing. And I had a whole plate of them. Like, I'm kid you not, it was like 12 to 15 cookies. No joke. And I still felt great.
Yeah.
I still felt great. Like, yeah, right after I was like, I'm a little off.
Yeah,
but
yeah.
I'm still fine.
Yeah.
Like, I still feel great. Took off my shirt. I'm great. Like, I feel awesome. I'm able to do my workouts. I'm able to do all these different things. And I'm not having an issue at all. So 20% of the time I'm eating whatever I want to eat. Moderation. That's what it is.
Moderation is key.
That's what it is. You need balance in your life. If you want that macaroni bechamel, you can have it, but don't have 3 plates of it, And if you do have 3 plates of it, don't have that every single day,
You're killing me. You're killing me.
I love macaroni bechamel, by the way. I love.
I agree 100%. I feel like sometimes we just get so lost into we have a lot of good food. We just can't help. It's.
And I'm telling you,
at least I can't help myself.
I'm telling you, this is from personal experience. I had eating disorder tendencies. It was never diagnosed. So during graduate school, whenever I would get stressed, I would go out to Popeyes, McDonald's, and Burger King in the same meal. Like, I would go to Popeyes, order a whole thing, like a whole number 10, eat it, and be like, not satisfied. Go to McDonald's. Let me eat this entire thing. Not satisfied. Then go to the next place and be like, okay, kind of satisfied. Let me get dessert now. So I had eating disorder tendencies. Wow. And I would do that when I would be stressed out or celebrating. Like, I'd be like, oh, let me go celebrate and let me go eat out and do the same exact thing. Right. So it was both sides of the spectrum for me. I did that for years, dude. Years. With the help of my wife and coaches and understanding that I don't need to have such a toxic relationship with food. Now I don't even crave McDonald's. Like, right now, I'm really craving a mango. Like, I really want a mango right now. And I'm the kind of guy, ask any of my friends, any of them, dude. They'd be like, this guy is wing king. He loves chicken wings. I love chicken wings.
Wingstop or Buffalo Wild Wings?
No. Wingstop is not good. I don't like that place. I really don't. I just don't think they have the selection of flavors that I would like in terms of the sauces. Okay. But Buffalo Wild Wings, bone-in wings, all the way.
Okay.
But I'm that kind of guy that I love to go to McDonald's. I'm always like, it's cheap, it's good, it tastes good, it's all these. But for me, now I don't have those tendencies because now I've built that stamina, that discipline of being able to put that off to the side. Maybe I'll have that Saturday, But today I'm just going to eat the meals that are in front of me, make those meals enjoyable. If I want to have a dessert, like a piece of cake, it's okay for me to have it, but let me have it in moderation. Let me not have the entire cake in front of me. Let me just eat out of the bin itself. Let me not do that. Let me just eat a little portion of it and then put it away. Or maybe take a piece out, put it on a plate, and that's it. I don't know if you follow Alex Hormozy.
Who's that?
He is a huge entrepreneur, great guy in terms of like business and business coaching and whatever it is. A big guy, millions of followers.
Okay.
He has this hashtag where he says, never skip dessert. And he's jacked out of his mind. Like he looks like he's on roids for sure. For sure. But I don't think he is. I'm pretty sure he's not. He always preaches naturalism. But
well, I mean, Liver King was preaching naturalism.
Yeah,
and he was even a natty himself.
I guess. But no, this guy, Alex Hormozy, I really like. He's biggest role model. And his hashtag is never skip dessert. Because he believes in the moderation aspect of things.
Do you think that the food that we eat impacts our, knees, tendons and ligaments?
5,000,000%.
Okay.
And the reason why I say that is because if you eat bad, you're not going to want to move. And if you don't move, what happens? Oh, all these different things happen. Say, for example, you're eating McDonald's every single day. And then all of a sudden, one of your friends is like, yo, let's go play basketball. Like, yeah, man, I haven't played in a long time. I want to get this weight off. I want to, all that.
Yeah.
Go play basketball and you tear your Achilles. You strain your calf. You have an ankle sprain. I'm not saying it's directly related to that. I'm just saying because you ate that food, you didn't go play basketball, and now you're playing for the first time in a really long time, what's going to happen?
Injury.
Maybe. Most likely.
Higher risk of injury.
Correct. And I'm not, again, it's not a direct relationship with the food.
Right,
it's an indirect relationship. But the reason why people get injuries, if it's not a traumatic thing, so if it's not a car accident, if it's not someone bumps into you, it's not any of that stuff. Most of the time, it's you're doing too much too soon. If you just prepare your body to do those things, whatever it is, basketball, jumping, change direction, agilities, running, those kinds of things, if you do that, you will prepare your body to play basketball and you'll be completely fine. I participate in all those different kinds of sports.
Yeah, I see you do like a mud runner or a tough mudder.
Did a triathlon. I did a Spartan. Did multiple Spartans. Did a tough mudder. I've done all these different types of things. And I'm not saying I never got injured before, but I'm saying that I prepare my body for these things. And I don't...
Eating right and all that.
It's not just eating right. It's sleeping. It's...
Sleeping
recovering properly.
So underrated.
People don't understand that.
Sleeping is so underrated.
It is a performance-enhancing drug. And people don't understand that. People are like, yo, I just have work and I just gotta, I gotta finish off these projects, sleep at 12 and then wake up at 6 in the morning. Like, how do you do that? I'm in bed by 9, like I'm snoring by 9:45. And I wake up at whatever it is, 5:30 in the morning.
Why?
I gotta make sure that I get my sleep.
Why do you wake up so early?
I have a part-time job. I have a business. I have things that I got to do, my own workouts.
You work out in the morning before you go to work?
I try to. I'm realizing more and more that doing my workouts like earlier on, especially when I'm in a hypertrophy phase, which means I'm trying to get my muscles bigger, I can't lift as much weight and get to the fatigue that I want early in the morning like that. But I do work out in the morning.
What do you think of Mike Messner or Menser?
Yeah, so I've heard of him. I don't really know much about him, to be completely honest. I've heard about his like one set, right? That's what he preaches, the one set of a specific muscle group, and that's what's going to get your hypertrophy.
Yeah.
I've heard of it before, but...
So I tried it.
And?
I mean, so for those of you who don't know, Mike Menser or Mike Mess, I always mess up his name.
I think it's
Menser.
Yeah.
So he used to work out with Arnold Schwarzenegger back in the 70s, whatever. And his methodology is that you don't need to spend hours in the gym working out.
Correct.
You can just do 1 or 2 workouts, couple of sets, and you're done. And it's for hypertrophy. And basically, what he says is, it's about the positive motion and negative energy and whatever. So basically, if you're doing biceps, for example, right, or if you're doing leg extensions, right, you're sitting down and then you're extending your leg. So it's not about how fast you're getting it up.
It's about the tempo.
It's the tempo, and also how much time you're resisting the negative motion or the negative energy going down.
The reason for that is that's called the eccentric.
So an eccentric exercise is the negative portion of
Right.
an exercise. And that the research shows that it elicits the most amount of load from that specific muscle. So if you can control on the way down,
Yes.
you are pushing the most amount of force in terms of that muscle force output.
And that's how he based his program. So I started watching his videos, and you know, the way that he does it, it's just,
Yeah,
you know,
I can understand that. Yeah.
like anything, bicep curls, leg extensions, squats, like his leg day routine, leg extensions first. You do calf raises.
Mm.
Then you do leg press. I'm sorry. Then you do squats. Then you end it with leg press. And seated curls. That's it.
Yeah.
Seated ham curls.
Yeah.
That's it. That's his leg workout. You spend less than an hour and you go home. Like you do one set of each.
Yeah.
One set of each.
The basis of all of this stuff has to be rooted in strength and conditioning principles. It's not about the way that you do things. It's not your methodology. It's the principles behind it. And the research is pretty dead set on these things. So if you want to grow a muscle, you need to have at least 10 to 20 working sets of that muscle group. A working set is basically you're getting to the point where you are within 2 to 3 reps of failure. You don't have to go to failure every time, but you are working pretty hard.
Mm-hmm.
And how we measure it is by 2 things. Either RPE, which is the rate of perceived exertion, which is basically a scale of 0 to 10 or 1 to 10, where 1 is I'm just sitting here, and 10 is I can only do 1 rep of this exercise. And you measure the intensity there. You want it like in that 7, 8, 9 rep range in terms of the RPE. Or you measure it with RIR, which is reps in reserve. So when you finish the exercise, how many reps do you have left over that you feel like you can do? Research shows, and talking about all these people that I listen to, Andy Galpin, Lane Norton, whatever, whomever, basically says that a lot of people, they underestimate their RIR. So they say, like, they finish and they're like, okay, how many reps do you have left over in you? They're like, I have 3. And they're like, okay, do 3. And they do 3 and they're like, okay, how many reps do you have left? And they're like, oh, I have another 3 in me. I have another 5. So they grossly underestimate their ability to get to failure. And I think that's one of the biggest issues when it comes to these things, that people don't understand what it means to actually get close to failure because they've never been to failure before. They've never gotten to the point where they're like,
They stop right before.
yes.
And
that right before is like, I actually have a lot more gas in the tank left, but they just don't want to use that. So if you do that 10 to 20 working sets per muscle group, and each of those sets you get in anywhere from 5 repetitions to 30 repetitions, and you get within 2 to 3 reps of failure, or pretty high in terms of the RPE, you will grow that muscle over the course of several weeks with something called progressive overload. Progressive overload is basically, in a nutshell, I'm going to simplify this, where you can either increase the rep range under the same conditions or increase the load week to week. And that's basically how you do it. It's as simple as that. Okay? So if you're able to get into one gym session and go to complete failure on certain things and then do that a couple times per week, then you basically got it. If you think about it, if you think about 10 to 20 sets altogether in terms of the muscle groups, you split that over.
that's a lot of sets.
It's a lot of sets, but if you think about, like, I'm trying to build my quad. So I do the leg extension machine for 3 sets, and then I do Bulgarian split squats, and then I do some of quad dominant, like, squats.
Stool squats.
Right there. Yeah, you got 3, 4
Oh, yeah. No, okay.
of each, and you're doing that twice a week. If that.
Yeah.
And you're getting it right there.
We can spend hours talking about.
Dude, this is my thing. Like, on a Friday night, if I'm not like at church or whatever it is, I will literally be in a corner just studying anatomy and muscle hypertrophy and how to do these things, because I feel like it contributes to how I work as a physical therapist. Because if I don't do that myself, if I don't have that knowledge, then I won't be able to impart that on my clients, my patients, the people that I surround myself with.
Do you think as Egyptians, we don't take our health seriously?
Absolutely.
That we don't work out, we don't care about eating healthy, we don't care about, being active, it's like whatever.
Yeah. I think it's a cultural thing.
Yeah.
100%. And the reason why I say that is because if you go to Teta's house and she makes you food and she has this huge plate and you don't finish it, and then she gets upset and she starts crying in the corner. ما أكلتش أكلي لي ما عملتش لي الأكل مش حلو. And she looks at you with those puppy dog eyes and you're like, Teta, don't do this to me. And then you got to eat the whole thing.
We're just very generous people.
Yeah.
We're very generous people.
Absolutely.
You know, if I make you food, I expect you to finish the entire thing. Like, I'm not taking no for an answer.
And then the way that we cook that food is like
with love.
Why
cook it with love?
With tons of butter, if you want to call
Semna.
Love butter.
Yeah,
man. Like,
that's how it is.
It's crazy. It's crazy. And I love the cooking. Like, it tastes so good. But then once you realize that there's another world to feeling good, feeling confident in how your body looks and how you're dealing with your day-to-day life and that kind of thing, you're like, dude, this is like a different experience altogether. And no disrespect, like, you're still eating the makarna bashmel, you're still eating the bid bastarma, you're still eating all those things.
You just portion 80-20.
Yeah. So for sure, culture plays a factor into all this.
Do you think that, you know, being a DPT, CS?
So it's SCS, CS, CS. Yeah, it's a lot of C's, SCS.
I was trying to remember all the all the letters. Do you think that virtual, I guess, or telehealth for PT is the future?
So when you say telehealth, I think in my brain that I'm getting on a call with Kero and we're doing 2 sessions per week and he's watching me work out at home.
Okay.
That is not how I do things.
Okay.
I provide a program. I give them alternatives. I give them certain exercises with descriptions and videos and regressions and progressions. So that if they can't do a specific thing, then they're able to do the regression. Try something else. And they do that. And they're able to do that on their own time. Yes, I feel like it is the future. Why? Because right now we're in an age of learning. Right. We want to learn as much as possible. Education is just so available everywhere. Now people can go on TikTok and they plan all their entire itinerary on vacation or trying to go to the gym or whatever it is. They just do that off of these social media platforms. So for me, again, it's all about principles. If you understand what I'm trying to do with this specific thing, and if you sit with me long enough for me to explain to you what I'm trying to do with this specific exercise, then you'll understand it and you will figure it out on your own. But some people don't want that. They just want, give it to me. I want to know the specific exercise, the specific sets and reps in order to get jacked, or in order to get my quads back, or in order to do this. And I think it'd be naive to go to one side of the spectrum versus the other.
You can't go from one extreme to the other.
Right. So you can't just say, do everything on your own, self-explore, I won't help you, I'm just going to provide you the tools and you do it on your own. And you also can't be like, I'm going to handhold you through this entire process. The businesses that do really well are more towards, I'm going to hold your hand. Why?
Just to provide
because it's
guidance.
easier.
Right.
Because it's easier for those people. There's no resistance in terms of what they want to do and where they want to get to. But I think in order to truly make a lifestyle change, in order to make this like, damn, I did that, and to make this sustainable, there has to be a happy medium somewhere in the middle where you get the education, you understand the principles behind things, but you also at the same time kind of have a little bit of hand-holding, guidance, understanding of things in order to do it. That's what I believe.
That's a very good answer. Dr. Kero, what advice do you have for somebody that wants to get into PT? What should they look forward to? What should they do? What should they study? What should they focus on? And, you know, why they should do it or why they shouldn't do it? It's a loaded question.
I get this question very often, actually. More often than you think. A lot of aides at the clinic, a lot of people who are in undergrad that are like, hey, he's a physical therapist. Let me go talk to him about this thing. I don't want to be a negative Nancy.
Okay.
But there are pros and cons to every single profession.
100%.
And as a young person who doesn't really understand a lot about the profession itself, you might be naive in terms of the fact of, I want to help people. It's like, great. That's a very vague answer. How? And do you think physical therapy fits that description? Because I've had many friends before who have wanted to go into physical therapy. They shadow one place and they're like, this isn't for me. Okay? I tell them, why don't you shadow someone else? A different specialty, a different person within this realm, someone who's cash based instead of insurance, because there's, again, like we talked about, there's so many different specialties within physical therapy.
Right.
Cardiac rehab, oncology, orthopedics, pediatrics, neurology, like all these different things. Shadow, figure that out, expose, especially when you're very young, right? In undergrad, you're just starting out. Let me go shadow this person. Let me go figure out how this person, let me go pick their brain. Let me go ask them questions. And then develop your own understanding of what it is. And then if that's something that fits your lifestyle, then go for it. PT does not pay well. It does not. And people don't understand that until they get out of school. When you think PT, you think of your typical clinic where you have brown carpets and you have weights that are no more than 5 pounds, and Teta is in the corner and she is after her knee replacement surgery and she's doing just leg lifts. And you're like, I just had an ankle sprain and I came out of basketball and I want someone to rehab this for real. And you're sitting next to Teta. And you're like, is this really the place for me? That's what people think when they think physical therapy. But physical therapy, again, is not like that. There's so many different facets to it. People don't want to go into that. But anyway, if you become a physical therapist and you do that and you become a clinic director and you're managing a clinic and you're all this, the ceiling is 150, 160K. That's it. And we're a doctorate program now. So in terms of tuition, we're paying a lot of money.
How much is tuition right now?
So it really just
A
depends. At this point right now, what I paid. So when I went to Minnesota, I had an in-state tuition waiver, which means that because I was out of state, I had to pay out-of-state tuition, but I filled out a waiver and they granted it to me where I was able to pay in-state tuition.
Oh, nice.
God.
It's at least like 60 grand a year.
I know right now that when I got out of school, I was in 180K in debt.
Okay. So it's like, between like 30 and 40 a year.
Something like that.
Yeah. That's not bad.
And it probably is a little bit more now.
100%.
So people need to understand that debt to income ratio before they go into physical therapy, thinking I can just help everyone.
All right.
Expose yourself a little bit. I'm not saying that physical therapy is the worst. I don't regret it at all. I don't regret it at all.
So if you didn't do sports medicine, sports physical therapy, what would you have done?
Ooh, it's a good question, man. It's a good question.
I'm glad nobody asked you that before. Since you have a plethora of specialties.
I would have considered a physician assistant for sure. I feel like that's 2 years. Are you talking inside or outside of the medical field?
No, I was saying if you didn't do sports physical therapy,
Okay.
would you have done a different specialty
Within physical therapy.
But now I know you wanted to do PA, so that's good. I got twofers.
What? I mean, if you don't do sports, then you do orthopedics typically. I don't see myself working neuro, oncology, cardiac rehab. I don't see myself working
You want
any
stuff
of that
that moves. You
because
want a walkie-talkie.
that fits my lifestyle.
Right.
That fits my lifestyle. When we talk about strengthening the muscle of a patient, I have to use those same principles that I talked to you about before of strength and conditioning to be able to build that muscle back up.
Right.
If I don't understand that myself, and if I don't work out, and if I don't do that, it's much harder for me to be like, you need to do this in order to grow
To
your
convince
muscle.
somebody to do it.
Exactly.
If you don't believe it yourself.
Exactly. So that's one of the biggest reasons why I work out. It's not just for the aesthetics and I look good and I feel good and all that stuff. It's great. But at the same time, like, it makes me become a better physical therapist.
Right.
And there's so many misconceptions out there, man. There's so many misconceptions.
Like what?
One of the biggest things that I've been facing recently a lot is stretching. If I stretch before I go out to this
That's
competition.
actually a really good argument. I would like to know the answer to that.
Sure.
Which one is better? Would you rather stretch before you work out or after you work out?
Why do you need to stretch at all?
So you shouldn't stretch.
Why do you stretch?
So what I read online is that it's inconclusive. Meaning, so I normally don't stretch out before I do a workout.
Okay.
If I do stretch out, it would be the same motion without weights, right? So if I'm doing, if it's a chest day, I'll be on the bench and I would have the bar with no weights on it, and I will do the motion.
Love it.
With no weights on it. If I'm doing a shoulder, right? I would do shoulder, like lateral raises with no weight on it, just to warm my joints up. I do stretch out after leg day because I don't want to cramp up when I go home.
Yeah.
So I don't know if I'm saying right now I don't know. Yeah. So please.
I love these types of conversations.
Correct me.
I love them. And I'm not correcting you. It's just, this is what it is.
I don't know, but you know, but see, this is the same thing that I told Clara and Pavli in the previous episode, is that I told them there's so much information out there.
Yeah.
I don't know what's right from wrong.
Absolutely.
I'm just reading everything. This guy's on YouTube tells you should stretch out. This other guy's like, no, you shouldn't. This is why you shouldn't stretch out. So I'm just like out here pulling my hair. I'm like, I don't know what to do.
Yeah.
So
yeah. So when it comes to stretching, you can stretch tissues, specifically muscles. So that's what most people do. And they think that if I stretch before a workout, it's kind of like rubber bands. I kind of stretch it out a little bit. It's a little bit looser. They're able to kind of do their workout. They're able to go run. They're able to do that stuff. What I tell people is that you don't need to do that at all. You just need to do what you just said right now.
Okay.
Go into the gym. What I do specifically is I do some sort of warm-up, anything to just get my blood flowing. Jump rope, I do some plyometrics, I do some light, and then I build up to pretty heavy. And then I go to my specific workouts, the exercises that I'm going to do, and I just do a ton of reps of something that's a little bit lower weight. And then I do a next set that's a little bit higher weight, and then I build up to pretty high. So if I'm in a dumbbell press, I don't start off with 80s right away. I don't start off with 90s right away. I start off with 30s, and then I go up to 65, and then I'm at 70, and then I'm at 80. And that's when I can start considering those things working sets. We talked about working sets before. The sets before then are warm-up sets. So I'm getting blood flow through my body. If that's something that you want to do, great. Because you want blood to be going into the muscles in order for them to be working and exercising. But in terms of stretching itself, what that does when you're stretching it out, there's been research that shows that if you stretch and then you go perform some sort of like strength workout or hypertrophy, it can actually decrease your performance in those specific things. Most of the research actually is in like sprinters or high level people. But the whole point of stretching, people think in their mind, is I'm warming my body up in order to do this specific workout. But if you're already warming your body up by getting on the bike and then or doing some jump rope just to get some blood flowing, and then you do some warm-up sets before you get into working sets, why waste that time stretching?
Well, why waste your energy?
Why? Why do that? The only people that should stretch in my mind are people who, gymnasts, ballet dancers, people who need that range of motion.
That flexibility.
Who need that flexibility to be able to do those things. And if you do stretch, putting your hand behind your head like this to stretch out your triceps for 10 seconds is going to do nothing. Nothing for you. It'll make you feel good. Maybe you look good.
I should not do that anymore.
It's wild.
I literally do that at the gym.
I know. People like back and forth and this and that. It's like, why are you doing that?
Wow. I didn't know that.
Yeah. And genuinely, I'm not making fun of people. This is something that I used to do. This is something that before PT school and before the things that I used to do, even in PT school, let me do this. Let me get on the bike and warm up my legs. And like, I didn't understand the concepts behind it. I don't understand why I'm doing this. Why am I doing this?
Right.
But you don't need to stretch. Like, people come up to me and say, I injured my knee because I forgot to stretch before. And I'm like, if anything, that is 1% of the contributing factor as to why you just injured yourself. The reason why you injured yourself, the biggest reason, is because you didn't do this specific thing in a long time. You didn't play basketball or jump this high or try to get a rebound or try to do this in soccer for a very long time. And now you're coming and you're playing 30 minutes straight of that specific thing. And then you're telling me, why did I injure myself? People are like, my joints are getting old and 30 is the new 80. And it's like, no, you just haven't moved. I'm 28 years old and I feel the best I've ever felt in terms of my own athleticism.
Right.
Because I'm moving more. I'm like giving variability to my system and the things that I'm able to do myself. So then when I do go out there, like when I do sprint or when I do play a sport, it's like I have sprints once a week in my program. I have these plyometrics twice a week in my program.
Right.
I've done these. So then I don't go out there and actually injure myself.
Well, that's actually very true because, last Thanksgiving I went out with a bunch of my friends when we played football. So I get there like 10 minutes after everybody else got there. So they're already almost done stretching. So I barely stretched. Barely. So, I was a dual QB like I used to do.
Yep.
You remember.
Yeah.
So I was a dual QB, whatever. And
Automatic QB. That's what we used to call it.
Automatic
QB.
Auto QB. So I'm standing there, and the guy you're allowed 2 blitzes per possession. So on the very first play, the guy blitzes me. So then I take off. As soon as I take off, my hamstring right away, because what you just said, I didn't play football in years, and the one time that I go play it, I immediately start taking off and running, pulled my hammy, was, juggling around the rest of the gingerly. I couldn't run anymore.
Yeah,
that
happens all the time.
I was like, just don't blitz. I literally can't move. Like, I'm just gonna be.
And the funny thing is that when
here.
people dose these things, so even physical therapists, if you're trying to get true flexibility inside of the muscle, you can't just do the stretch for 10, 20 seconds. You can get short-term flexibility in terms of you stretching a muscle, but that's going to take 30, 40, 45 seconds of you holding that position multiple times for you to get that short-term change in flexibility of the muscle itself.
So unless you're doing it for at least 45 seconds, couple times before you work out, what you're doing is useless.
I mean, even if you're doing it at the right dosage, what's the point of doing it? Again, like we talked about before.
So there's no point in stretching out.
Unless you're a gymnast, dancer.
And there's no point in stretching out after a workout.
So some people think that alleviates what we call DOMS, or delayed onset muscle soreness. So the soreness that you get later on. There has been very minimal research to support something like that, where the stretching itself is able to reduce the amount of soreness that you have.
What about cramps?
Cramps itself, they're very up in the air. And I'm not saying that because I don't know, but it's just the research doesn't know. So a lot of people think it's lactate buildup or lactic acid, right? They're like, oh, we have all these like free hydrogen ions inside of the muscle cell, and this is what happens and whatever. Yeah. And that's where you get cramps. But we actually don't know. There are several theories as to why this happens. Most of the time when people get cramps, it's typically, what I think, in my case, is that they haven't done that specific motion at that length before. Does that make sense?
Right.
So, for example, if I am doing the lying hamstring curl machine, you know that one? And you're doing it single leg, and then you bring it up like halfway and all of a sudden your hamstring cramps. It's because your hamstring has not been strengthened in that position before. So I don't think I think electrolytes do play a factor.
I was just going to say water.
And hydration.
Right.
And some people are like, pickle juice, and I got to do these things in order to make sure that I don't cramp. And I think, yes, that does play into it.
Good.
Yeah.
Potassium.
Electrolytes. But I don't think that's the main thing that is contributing, because, again, we don't know exactly why
it's just not strong enough to bring it up.
That's what I think most of the time. Yeah.
Man, I learned a lot tonight. That was good. If you come back on here again.
Dude, man, I love talking about these things because there's so many misconceptions out there. And I think once we start just deleting the fluff, things just get so much easier for people.
Right.
So they're like, they have these just ingrained concepts in their brain from when they're younger of, I need to stretch or I need to, etc. You don't need to do anything.
Yeah.
You just need to. So when people are like, okay, but like I've never ran before, I'm going to get shin splints. I'm like, the reason why you're doing that, so shin splints itself, it's called medial tibial stress syndrome. That's what we call it. That's a fancy term for it. And what happens is that the muscle on the inside of your shin just starts pulling on the bone itself, and then you get those shin splints. Yep. Yes. The reason why people get that is because they do too much too soon. That's it. My wife, when she goes out to run her 26 miles or whatever, and she's been running for years, so give her that. But when she goes out, she doesn't stretch, and I'm going to pull my hamstring, and I'm going to do some sleeps. I'm just going to run at a pace that I feel comfortable right now. And as I get warmed up, I'm going to start going a little bit faster. That's it. There's nothing else to it.
So she doesn't stretch.
She doesn't stretch.
She just runs at a slower pace and then slowly picks it up.
And then she recovers afterwards. So a lot of people, they're like, I'm going to take up running. And then they run 6 miles the first day, 5 miles the second day, 3 miles the third day because they have motivation. And they saw someone like Bishoy and they're like, he's running all this mile. I'm going to run it. And they do it that first week and they come up to me later on and they're like, I have shin splints. I don't know what to do. And it's like, dude, like this is your first time running ever. Do it every other day. Do 1 mile. See how it feels. See how you recover. See how it feels the next day. Soreness is not how much you worked during the session. It's not a measure of how hard you worked during the session. Soreness is a measure of how unused to you are to that specific thing that you did.
Right.
So if I, for example, I'm jacked, freaking jacked, but then I go play basketball, I'm going to be sore the next day. Why? Because I haven't used that muscle in that way in a long time.
Right.
And that's why I get sore.
You haven't used your body like that before.
Correct. Even though they're jacked, they're like, oh, you're so strong. How are you sore? You know? They do leg day. They never skip leg day. They do all the right things. But it's because you haven't used it.
The cutting,
Exactly.
the turning.
All they do is this, and they do this.
Push and pull.
Very heavy weights. And good for them. They got big muscles that look amazing. But they've never done that specific thing. So you're eliciting different fibers within the muscle itself.
All right.
And that's why you get sore. And it's not a bad thing. Soreness is not a bad thing at all. Just take it on. Make sure that you recover properly. Take a day or two and be like, okay, I feel good. Now let's do it again. We're very adaptable, plastic human beings. If you don't give it the same stimulus over and over with the proper recovery, and again, sleep, nutrition, hydration, feel good. If you don't do those things and you don't give it the same stimulus over and over again, you're going to injure yourself. You're not going to feel good. You're going to be like, I'm going to give up on this specific thing. But just take it easy. This takes months and months and months. And people think they're just going to go into the gym like we talked about in the very beginning. They're going to go into the gym, they're going to lift one weight, and they're like, Hulk.
Yep.
It doesn't happen like that.
Yeah.
You know?
Education.
It really is that. Do it. Do the thing. Recover properly. Do it more. And then eventually, once you start to get better and you're optimizing things, then do it better.
Right.
Get me the right shoes. Get me the right equipment. Get me the right this, that. Fine. But that's because you did it for so long. You understand the nuances of it. And I heard something recently that was like, this age is the death of nuance. And I think that's so true. Because people just want black and white. They just want, give me, is it this or is it this? Do I stretch or do I not? But it's not like that. There's so much nuance in the middle. There's so much stuff that you're missing.
You know how like you go online and you see all of these different like pictures or memes, but it's like you have the guy that is in a cave mining for a diamond, right? Everybody's has seen that.
Yep, seen that
Right.
before. Yeah.
So it's like he's so close. He's like he's underground and he's so close to get to that diamond, and he stops and then turns
before.
around and leaves. You know what I mean?
Yeah.
And I feel like that's like nobody wants to do the actual work.
Yeah.
Everybody just wants to be on the surface and then just pluck, you know, whatever. It's like right there. This is not how it works. You got to put in the work. You know. So
I might get a lot of flack for this, but I think that's why a lot of people take things like Ozempic and do the stomach surgery and do those kinds of things. Some people truly have conditions.
yeah.
So they truly have like diabetes and they have different things and they've tried the lifestyle
Thyroid
changes.
problems.
Exactly.
Diabetes. Yeah.
I totally understand that. And I'm not blaming those people at all. But those people who haven't even tried to work out or try to make lifestyle changes and then they do this thing just because a wedding is coming up, that is when I'm like, yo, what are we doing here?
See, these things terrify me because they're new and we don't know the long-term effects of them and what it's going to be like. So, I don't know. I don't know. It's a very touchy subject.
Yeah.
'Cause I know people that take them.
Yeah.
And I'm sure you do as well. And there are people that take them for, you know, medical reasons, and there are people that take them for other reasons. And, you know, it's whatever. Like, it's fine. But I'm more terrified of the long-term.
Yeah. Because the
effects.
research is not good on
It's not
what's
good.
happening long term. And
Yeah.
genuinely, as a disclaimer, it's not like I'm against that person. It's
Oh, yeah. No,
I am saying this is nothing personal.
Right.
This is just, have you tried this lifestyle change before?
Right.
Because when it comes to anything in terms of like physicians, they always tell you to go to the conservative way first. Let's try lifestyle changes, conservative management,
Right.
instead of going straight to the medications and trying to get you on a million things and
Right.
whatever it is. But if you need a shot of Ozempic in order for you to kickstart your fitness journey, and this will make you make the lifestyle changes that you need, by all means, use it. But I think those people that are like, black and white, I have a wedding coming up and I have this thing and I just want the easy way, quick way out, that is, we're turning into a lazy society. We're not doing the things that we should be doing in order for us to get to the places that we want. Because what it does is, not only does the lifting and the exercising make you feel good, it's a mental thing too.
All right.
So what I mean by that is, when people, for example, the only way to feel truly fulfilled in life is when you do something hard and you do that thing really well, and at the other side of it, you're like, damn, I did that thing. That boosts your confidence. That boosts your self-confidence in being able to do more and more and more and more things. So when you're able to get into the gym and you see results after 2 months, 3 months, 6 months, a year, like, damn, I put in that work and I got the results. And your aura as a person, your energy, just becomes skyrockets in terms of your confidence overall.
Your endorphins.
All of it. Your entire body just changes. But again, when you do something like you take these medications or you do whatever it is, again, disclaimer, I'm not a physician. You should go check in with your physician and do it for your own reasons. Everyone is customized in terms of what they're doing. You don't get that, like, I did something, you know?
That satisfaction.
Yeah.
Yeah.
You don't get that, like, purpose, meaning, like, I did that, you know?
Yeah.
And to me, that's a very important thing in life, that satisfaction,
Right.
the purpose, the meaning, looking back, reflecting. That's end all be all for me.
I mean, again, we live in a different time now where everything is available. Everything is available at the palm of your hand, literally. We are very impatient for information. We want immediate results, you know.
That's with everything. I don't think that's wrong. I don't think it's wrong to get.
Yeah, but there's no loving the process anymore.
Yeah.
You know what I mean?
Yeah.
Like back in the day, working on a computer. Like I remember back in the day, just to log on to the internet. You know, this is probably you probably like not even born yet.
AOL, MySpace.
The
dial-up internet connection.
Dial-up internet connection. I don't think you remember that.
I do.
You remember that?
I do. Yeah.
You remember AOL?
I do. Yeah.
You were like what? Like 6?
And I don't remember the years that it came out, but I do remember AOL.
It was in 2002, 2003.
Yeah, I was 7, 8 at the time.
Okay, so you do remember it. Yeah. Yeah, like that was the internet, you know. But I don't know. I feel like right now there's an overload of information.
Yeah.
Overload of information everywhere. I think that we have so many things out there for everybody, and people right now are. You have a choice to make. You want to go work out, you can work out. You want to take a drug, take a drug. You want to have surgery, you can have surgery. You know, there's no
one can tell you no.
Whether you have a medical condition or not.
Yeah.
You know what I mean? And so I think right now we have more autonomy than ever before, especially in our bodies.
And that stresses us out.
Yeah. And then that's why, it's challenging, but at the same time, everybody's different, and people that really want to change their life are going to change their life no matter what. So
I agree with you 100%. I think for me, I struggle with I need more. I need more information. I need another course. I need to understand anatomy more. I need this guy. He looks good. He markets great. I do that myself, so I suffer from it. I'm not saying that I'm a perfect human being.
But that's actually good, because I would want you to know what you're talking about.
Exactly. But I get so stressed out to the point where I don't know if stretching is good or bad. So when I talk to my clients, it's like, do I listen to this guy who's also a physical therapist on social media? Or do I listen to this guy on the other side of the spectrum who's also a physical therapist? Do I listen to that guy who tells me don't stretch or do stretch or whatever it is? Like, everyone's just all the time.
Yeah.
You know? And in my life, what I'm trying to implement a little bit more, and what Claire is really teaching me, is less is more. Less is more.
Yeah.
Focus on the tasks at hand. Less. Understand what you have. Focus on the step that you have right in front of you. Don't think about the future. Don't think about the past. Just live. Present. Now. I struggle with that deeply, truly. That is one of the things that I struggled with for several years. Where I'm just thinking too much about the future. I'm overthinking. I'm like, what if my business fails? What if I do this? What if people don't like me? What if blah, 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 blah. And that is the same idea in terms of information. It's just overload. You're just getting bombarded with information. And you don't know what's right, what's wrong. And
Well, that's where the gym comes in. It's great for your mental health.
absolutely. And I think even within the gym, you're like, now if you try to get into fitness and you try to start doing things, one guy A says this, girl B says this. They're differing opinions, but they both have jacked bodies. Who do I listen to?
I think a lot of this is why I deactivated my Instagram 2 years ago.
I duly appreciate that.
Because it wasn't good. It's not good for your mental health, first of all.
Yeah.
Have an Instagram. The only reason why I have Facebook is because I have family abroad and I have friends from my school in Egypt when I was younger that I keep in touch with. That's a means of communication. But truthfully, I don't think a lot of these social media influencers are natties. Natty's natural.
Yeah.
Meaning that it's a natural growth. Like there's no steroids, there's no growth hormone injections or anything like that. I think there's a video that's been circulating around of this guy. He's like a bodybuilder and he goes to this like bodybuilding convention or whatever, and he's going around asking all these guys, "Are you natty?" And they say no. And
At least they're honest.
And they're all jacked.
Yeah.
They're all jacked. And so this is why I just try to read online. When I just try to read online, I try to watch videos, and everybody's gonna have conflicting opinions. But what I think is working for me is that whenever I'm at the gym or whatever, and I'm doing a certain exercise, I start doing it, and then sooner or later you'll find out what works.
Exactly.
You'll find out if you're doing a shoulder press, but you're not feeling it in your shoulders, then you're probably not doing the right exercise.
Exactly.
So it's gonna take time. I don't think there's a one person that knows it all.
I don't think anyone knows it all.
I think that everybody is gonna tune their own what is it? Harp their own tune, tune their own harp.
Toot their own horn.
Yeah, toot their own horn.
Yeah.
Had a little fob moment here, but it's I think they all do it because they're selling a product or they're promoting something.
Yeah.
Whatever.
Business.
I don't know. Just keep working out. Keep trying it. If it works, it works. If it doesn't, you're doing it wrong. That's to a point.
Yeah, exactly. But
Don't injure yourself.
I think people, when they hear like you're doing it wrong, they kind of take that in a negative connotation, and it's like, it's okay. This specific thing didn't work out for you. That's okay. Literally say that sentence. This specific exercise routine did not work for me, and that's okay.
Try with lesser weight.
Try anything. It doesn't matter.
Yeah.
That's the self-exploration piece of it.
Yeah.
And another point that I really want to mention is that people, when they think about fitness, getting into the gym, they only think bodybuilding.
Yeah.
There are so many different things that you can do with fitness, within the realm of fitness. And that's why the first thing when I ask people, when they ask me about like fitness and exercise and all this stuff is, what are your goals? What do you want? And be honest with yourself. Do you want to actually look good? Like, do you want to just take off your shirt on the beach and just be like, I look good, dude? If that's what you want, that's okay. Many other people in the world are like that. They just don't say it. Be honest with yourself. And if that's it, there are many ways to go about that. But people think it's just, if I go into the free weight area or if I do this specific thing with heavy amount of weight, then I'm going to get jacked. And I don't want to look like that guy on stage that tans himself, puts a spray tan on, and just has other people judge his body in the way that his muscles pop.
Yeah.
Honestly, all due respect to people who bodybuild, because I could never. I could absolutely never. The way that they are strict with themselves and able to get their bodies to look like that, great. But for me, that's just not functional. That's not something in a day-to-day life for me. For me, it's all about looks, longevity, health, and just feeling good, man. Just feeling good.
Right.
You know? That's what it is for me. And so I have my goals to be parallel with those specific things. My
And there's
exercises are
nothing wrong
catered
with
to
that.
that.
Yeah.
There's nothing wrong with that at all.
Yeah.
There's so many different ways to go about that, but people just don't understand it. They don't understand it. And they don't see the results right away. And they're like, oh, man, like, I'm never, and all these absolute words.
Yeah.
Don't do that to yourself. Don't do that to yourself. I heard something recently on Instagram. And this is the good thing about Instagram, because sometimes you doom scroll and you're like, okay, I'm getting one good thing every once in a while. But it's like, practice is where you go to win the game, and the competition is where you go pick up the trophy. So the same exact thing inside of the gym. That is where the work is. Your nutrition is where the work is. The sleep is where the work is. When you take off your shirt on the beach on the 4th of July, that's when you're like, damn, now I'm reaping.
Now that's when you pick up the trophy.
That's what it is. But people don't get it.
No.
They're like, I want 6-pack abs now. What's the fastest way? How can I do it?
Just do crunches.
That's a whole nother story that I don't want to get into. But yeah, man. I'm truly passionate about this stuff because it's not just the physical therapy aspect of things. It's like I want to have a holistic view of what it means to go from injury all the way up to performance. And performance can mean high-level sports, or it just means I want to play pickleball on the weekends with my friends as an amateur.
Right. And
everything in between. Everything in between. That's why I do what I do. I want to have that like holistic. I really understand anatomy, really understand biomechanics. I understand how to grow a muscle. I understand what strength and conditioning is, but I also understand the injury side of it, the medical side of it. So I'm able to combine all those things. And then when people ask me, I want to get here, let's do it. So if you do have a setback, it's not like, oh, personal trainer, let's just like modify the range of motion, which isn't a bad thing at all. But it's like once you modify the range of motion, you don't know what to do after that. It's like, I ran out of ideas. I don't know what to do.
Yeah.
And that's the difference between a personal trainer who takes an exam real quick, studies, whatever it is, and then a person who has a doctorate. Hopefully. That's what
as long as they get above 80.
Yeah, exactly.
Kero, thank you so much for coming on tonight.
Of course, man.
I really appreciate it. I can't wait for you to fulfill your vision, and hopefully I'll come to you. Maybe I want to get a 6-pack by 4th of July.
Yeah, absolutely,
man.
By the 4th of July.
Let's get it. Really appreciate it, buddy.
All right, man.
Good to see you.
Of course.
All right, buddy. Before we go, where can people reach you on social media?
Yeah, so I'm pretty active on Instagram. It's at Kero.dpt. And I'm on Facebook as well, not as often.
Okay.
And you can reach me through Instagram. I answer pretty much all of my DMs.
At Kero.dpt.
Correct.
All right. Thank you, Kero. Thank you, everybody. We'll catch you in the next one.
Peace.